name is Ajamal Binden, and I'm the chair of the board of MORE, and MORE stands for Movement Omaha for Race Equity, and we've been around for at least 10 years working on issues related to progressive issues. And we're probably one of the first organizations, our only organization, to deal with anti-racism in our mission statement. And so we've done a number of community events, and this is one of the things we do, a number of Zoom, Facebook Live forums where we bring people in the know, people from the community, let them speak for themselves, and we play the role of facilitators. Tonight, the format, we're going to have people, Nick and I will interview our guests for about 45 minutes, and then we're going to open it up to the audience. And so you can fill information in the chat, as well as you can also talk probably directly to them. And then we will also have an evaluation. So MORE is standing for Movement Omaha for Race Equity. And it's been around for at least 10 years. And our goal is to kind of challenge the institutions and systems about some of the very issues we're going to be talking about tonight. So I'll pass it over to Nick, who's on our board of directors. And there's about a 14-member board. We're all volunteers. And so basically a lot of this stuff, we don't have to answer anyone but ourselves. So we're kind of excited about that. So without further ado, Nick, you can go for it.
Yeah, thanks, Jamal. So my name is Nick Bullier. I've been on the board of MORE for more than 2 years now, and I'm also a filmmaker and independent journalist. And I'm really excited about the event we organized tonight. And I want to give a special shout out to Wyshell Davis, who was really instrumental in coming up with the idea with me and kind of organizing the panel and getting everyone on the panel to be here tonight. So I want to give a special shout out to her. But tonight, as Ajmal alluded to, is going to be about mental health, and specifically mental health in the Black community, as well as the nuances around how racism affects mental health, which is what really aligns with the mission of MORE. So I'm going to introduce the panelists, and then we're going to roll right into our questions. And one of our panelists is Larry Duncan, who is not immediately on the call, but he said he's going to join us in about 15 to 20 minutes after. And so when Larry comes, we will give him the spotlight too. But on our panel, the first person I want to introduce is Dr. Donna Polk, who is the CEO of Nebraska Urban Indian Health Coalition. The second person is Frank Bailey, who is the clinical director of Bailey Counseling Services. And then we have Tamika Mease, who is the executive director of North Omaha Community Partnerships. So the first question I want to ask, and I'll direct this one to Frank, is if we could sort of get a, just a description of the mental health care landscape in Omaha, and sort of how those options correspond to cost, access, and specialty for those who need it in the African-American community. I think that would be a really good launching point for our discussion.
For the, I'd say like for the Black community, as far as any specialty, it's a broken system. It's a ineffective system. That's the thing. If you notice the amount of money that's being poured into the other organizations to solve the problem in the Black community, they're not, it's not effective. Like when I look at the problem, it says, if you look at the problem, it says, despite the programs and services that's in our community that exist right now, just with the youth, they're becoming more and more at risk when you look at the shootings and things that go on. So when you're talking about just the, say the cultural competency of some providers are pretty inaccurate. And when you talk about as far as collaboration, because I started a new portion of my business, I am going to open up a trauma center, and because I specialize in EMDR, I'm only Black male therapist that does EMDR. You would think that I would have more referrals from the system, but I don't. All my referrals are by word of mouth. So I'm attempting just to collaborate within the North Omaha community with other agencies, other Black providers, and it's very, very difficult to do. So when we talk about just what racism has done to our community and the amount of intergenerational trauma that exists, it even affects the providers within the community. It's wide ranging. And then just when you begin to talk about mental health in the Black community, it's like a taboo subject. It's just like, it's almost like, the idea of getting mental health back in, say, like the 40s, 50s, you go to church and get prayed for. That was the whole thing. Now it's just like there's nothing there. If you go over to 30th and Ames and just stand there, you can see more Black people wandering around that have mental health and that are homeless. And then when I view that, they have these outreach teams that go down by the river or they go to other places to reach out to the homeless that have mental health, but you never see them on the north side. You never see them in that area where these people are panhandling on the streets and things like that. I worked at the Francis House for 15 years. So I know what the community is like when you talk about at-risk populations that are African-American that have mental health. I know who they are, walk up and talk to them. But as far as like these outreach teams coming into the North Island community, reaching out to these individuals, it just doesn't happen. So when you talk about how racism has affected the Black community, it's affected the providers because of the intergenerational trauma, the lack of collaboration, and then just the lack of cultural competency by providers. I gotta be quiet.
Yeah, you know, I want to be conscious. We got 4 different people going to be here, so I want to give Tamika. I'm going to switch up on you here because I got a question directly to you because we want to be conscious that we got 4 panel members, which is a lot. So I want to give everybody opportunity to talk. Tamika, I want to ask you a question. How has mental health funding evolved in Nebraska since racism was declared a public health crisis? Again, have you seen any real tangible changes from that declaration? I think the Department of Health made some statement about a year or so ago on that issue, and other states are dealing with it and counties and so on. So from your vantage point as a practitioner, how has it evolved from you in your work that you do? Your voice is not there. I can't hear you. Got to turn your mic on.
All right, apologize.
Good, there we go, no problem.
Okay.
No, you're in the house now. I was like, boy, I thought you was, I said, well, hold on now, hold on. Okay, we good. Go ahead.
Okay, well, first off, I am not a practitioner. I am an advocate, and I do run a mental health program called Bridge the Gap. And in regards to addressing, you know, the mental health crisis in the Black community from a racial standpoint, I don't think that we've accomplished that. I think what has really gotten the ball rolling, and it's been somewhat of what I call a trend, has been the pandemic. The results of the pandemic, it seems like mental health has been like a trendy word, a trendy topic, and it seems like everyone is hopping on that bandwagon because it's politically correct to do so. But to be intentional about providing more mental health accessibility and funding for the Black community, I haven't seen that happen.
Okay, got you.
So I have a question for Dr. Donna, and this kind of just speaks to, again, addressing sort of the landscape, you know, to give you sort of a scenario. You know, if you're, you know, low income and don't have a lot of connections or resources, and you're trying to connect, say, your child with a therapist, what options do you have? And where do you think there is a big gap when it comes to accessibility, where there needs to be new options sort of introduced to the community and to the city?
Well, I believe the system is so broken that I don't know what it will take to get it to a place where anyone could access care regardless of their race. We really lack the expertise. We lack access to services. When you look at any form of healthcare, any form of access to food, if you can't get to it, then it might as well not exist. And like I said, our system is it's antiquated, it's broken, and I just don't know what to do about any of that, because the system is so structured that it doesn't really allow for people who have new ideas, new options to offer, because it's the status quo. Or they will bring in a system or a part of a system that they think will meet the needs of a community, but it doesn't, whether it's a family with children. They might serve the children, but then the family, the parents or the guardians don't have access. So that's the problem as I see it. And of course, one of the big issues that I think I don't know if Frank or Tamika addressed this, is lack of cultural competency. We have institutions that train people, but they don't even have clinical services offered where they do the training. So how do you know how well you train someone if you don't have a chance to see them do their work?
Mhm. Good, good. You know, I'm gonna switch up a little bit. I know, Nick, because we kind of had a little sequence, but I'm gonna come if I can to jump it down a little bit. And I know Frank Dunn, we come to you, but I'm come back to Tamika. You said something about your role as a more of a practitioner, controller, and so on. And my question somewhat is this stigma that's in our community in mental health, how can we help improve some of those conditions to get people more involved in like the work that you do? Again, your role is like a director, you're a facilitator, you help bring people together, because obviously in our community, we haven't done a lot of that. But how can we improve those conditions? How can we deal with that?
Um, my opinion is to think outside of the box. So what has worked or what they thought was working for all this time, which we all know it hasn't been. We have to, think outside of that box and meet people where they are. We have to rebuild that trust in the community. We have to recognize the stigma, especially in the Black community, when it comes to mental and behavioral health. There has been a stigma that I want to say started around the 70s and blended into the 80s. And by the time we got to, that point, it was frowned upon when it came to, having receiving mental health services because you were, a kook, crazy, you had all these labels and people shied away from it, especially, with what they've done within the Black community. It's like with even within our culture, let's talk about culture. It's you don't discuss what goes on at home, but then that, you have that trauma that goes untreated and unaddressed, and then it transfers generation to generation. So I would just say meet people where they're at. With our program, we focus more on the treatment and getting the help rather than the financial aspect. So with our grant funds, we pay the bill. We don't ask for too much information. We meet people where they're at by addressing wraparound needs with our services. So if they're experience a crisis such as a drive-by shooting, or one of their family members have become victims, of murders or shootings or gang violence, we address them, with that particular situation, and we offer, the mental health piece. And with offering the mental health piece, we're not asking for any financial information or any insurance information for that matter. We just want to know your name, your date of birth, and if you're a minor, we want your parents' consent, and we address that crisis situation. They're already in the middle of a crisis. When you're in the middle of that crisis and that trauma has been inflicted, who has the mental capacity to think about, filling out a bunch of forms and everything that's going to deter them from the service? They're going to say, forget it, I'll deal with that later. And then later never comes.
Right,
So
right.
we have to, think outside of the box, and then let's recognize these grassroots initiatives such as mine and others, and such as, what Frank has going on, with what he's trying to build and how long he's been, in the profession, and how, he explained how he gets his referrals is word of mouth and not through, the professional entities that recognizes him as a provider. That's a
Mhm.
problem.
Right,
That is a problem. And so we have to address that head on. Let's not sugarcoat it. It's a
right.
problem. Let's fix it.
By the way, I want to interrupt, and this, Nick, I'm gonna call an audible here because something hit me as she was sharing this concept. What is your relationship with the School of Social Work? When I was teaching in School of Social Work, they would have therapists out there, but in that days, they had people who taught the Black family or dealt with race issues. They didn't have a clue. And I remember a student said to me, she was interviewing her, having therapy with a man, an African-American man, and he was very resistant. And she asked me how to help him a little bit. But my point or my question is, what is your relationship with the academic community in the work that y'all all do? Again, I don't know that, but I just want to say, are there social work students that work with you, or you work with the university? Creighton has a social work department, UNO has one, yada, yada, yada. So as a whole, how the academic work with you, with each one of you folks in your various capacities, or do they?
Well, as far as the therapists that we work with, we specialize in working with people of color therapists because of the
Oh, what I'm asking is, what is your relationship with UNO or Creighton? Do they
oh,
do anything with any of you guys on a decent systematic level? Because they're turning out social workers who are doing some of the very things you're talking about. At least they say they are.
right now we're in the process of developing that partnership with UNO and with Metro Community College.
Okay,
But for
gotcha.
right now, the interns that we work with actually are from Capstone Behavioral Health,
Okay, gotcha.
which
Okay,
they have
good.
interns from Bellevue
Okay,
University,
got it.
Metro, and
So
UNO.
there's a relationship.
There is a relationship with the interns, and it provides them with the experience, and we also get to interact with them and provide that cultural awareness piece
Okay, gotcha.
that a lot of our professionals are missing.
Got you. Frank and Donna, do either one of you work with people in the academic community in your work that you do?
Yes, of course. In fact, I met with Dr. Von Nebbit, who is the new director and the first person of color that I'm aware of who heads the Grace Abbott School of Social Work. And you probably remember, Jamal, that the school was moved to Omaha in an effort to expand the experience of the students. And that was before I realized how segregated Omaha itself is. It's as segregated, if not more, today than it was when I arrived here in 1964.
Wow.
And so we can only see the results of that labeled or combined with gentrification that's going on. And I think that explains a lot of disaster that's occurring in the community. But yes, we've had a long-standing relationship with Creighton and UNO
Good.
and UNL
Good.
and
Excellent.
UNMCC.
I'm glad. Good. Frank,
Yeah.
Frank, do you have a relationship?
No, I don't. I've been around for 20 years and I do not, which is surprising based on just working at Francis House for 15 years. What I had recently happened, I had an organization down in Lincoln reach out to me to develop basically a DEI training for therapists.
But by the way, when you words DEI, I can
Diversity.
Yeah, I come
Okay.
from Omaha, so we don't learn all these acronyms. They don't teach all that, so you got to break it down because I'm kind of slow some days. Okay.
It's diversity, equity, inclusion.
Okay, good. Thank you.
So they want to learn how to work with at-risk youth because it's an organization that's all Caucasian and they work with a large number of youth from Lancaster County. They're involved in the justice system.
So in other words, you don't do a lot of work with the academic community. In other words, okay.
No.
I'm gonna pass it back over to Nick. Nick's next in line.
So,
Nick.
Frank, I had a question for you, kind of in line with youth again. I was at the community meeting that was at Omaha North several months back. That was kind of to address the sort of violence that was occurring, and Washel was there too. We both heard you, talk about how it was easier for a lot of kids who had gotten into the juvenile justice system to get access to mental health care specialists than it is for kids who don't have had that exposure yet. Is that goal been addressed by the city at all, or can you speak a little bit more towards that point? Because I found that was like a very telling revelation and something that I think really should have a lot more, public attention.
They're the thing is they're trying to address it by developing these like assessment centers they want to put in place, but that's years down the road. So like if somebody's in a crisis, in the Black community, majority of the time, the first thing they do is call the police to try to access these services. And because when you're talking about just the intergenerational trauma that's involved with that, it just makes it even worse. Because right now, a lot of parents that I do finally meet them, they're trying to find a place, and they can't access nowhere. It might be because of funding, might be because of insurance, might be just because of a whole bunch of reasons, or they just don't know. But there's a big gap that exists. And as you begin to see, the problem is just getting worse and worse.
Right. I want to switch up a little bit. Don, I'm going to throw this at you. I was aiming at somebody else, but I'm third. It's a very appropriate question. And again, it doesn't mean that y'all can come back at each other and raise questions, even disagree. So we're okay with that. But one of the things that's concerned me, I've been reading the paper about everybody's going to talk about in recent months. There's all these initiatives to build local government healthcare giants. There's going to be a new children's wing that deals with mental health issues to the African community. You see all this COVID-19 money sliding in. Everybody talking about that Douglas County who ain't busted a grape sometime with some of these issues. Now they're talking about some major mental health issues more so. And some of them don't have serious track records to the African American community. How can we ensure, again, from long run, the funding, that there's accountability from some of those funders? And again, there's one thing about cultural competence, but there's also accountability inside of institutions, whether it be Children's Hospital, Douglas County, anybody who's doing major initiative in North Omaha to African American. Again, part of the question is aimed at all of y'all in a sense also, but how do we make sure we have that golden standard of whatever we're going to have good housekeeping still of dealing mental health with our community? I know, Donna, you have a lot more history in the city of mental health than most folks, because I know you talked about trauma. We didn't know what the word trauma meant, where kids were getting shot. But how do we make sure that happens? So it's not like a fly-by service.
You have to have the right people at the table. In this community, because of its makeup, it tends to only listen to those people who I consider as grass tops. The grassroots people, including those who are affected by what we're discussing tonight, are rarely gathered together by people who have control.
Wow.
Now, I make it really clear that my interest really lies with my tax dollars, and I pay a lot of taxes. So the money that comes in, for example, to a political subdivision like Region 6, I think that money needs to be really spread out across reputable organizations that provide the services that we're talking about. Now, one of the things that I think we must pay attention to is the way we use the language. We are just now beginning to talk about mental health. And that's why it's confusing to some groups, because they automatically think you're saying they're crazy. And that's not true. We used to say addiction and alcoholism or alcohol abuse. We
Right.
used to call people who were counselors, counselors, and people who were therapists, therapists. Some people don't know the difference.
Right, that's true.
And so people get really confused when we use inappropriate language to describe the problem. But most importantly is that we have to figure out how can we hold people accountable for the money that is needed in the community to fund the services that the community will respond to.
Good.
And the other thing, Ajamal, I have to say this, we have to quit focusing on race. I'm telling you, because just as we're here talking about Black people, there are white people talking about white people, and Hispanic people talking about Latino people, and Native Americans talking about Native Americans, which is my constituency, without realizing that these people intermarry, they live in the same houses, they go to the same schools, and until we realize that we have to address the issue without saying it's only these people, or we got to focus on this problem.
So don't, in other words, don't stigmatize a particular racial group or a class or whatever. I got you.
Exactly.
I understand.
I think that's just my belief.
Gotcha. I hear you, Nick.
So I want to ask a follow-up question to Tamika, because I think that, you know, grassroots organizations are so important to addressing like the short term, especially in Omaha with what's going on. Can you talk a little bit about, you know, the funding that your organization has been able to get? Has it allowed you guys to grow, or what you know, what do you think your organization needs to be able to continue to support at a bigger scale in Omaha?
Okay, I'm gonna be blunt with you. We need more money.
Wait. You just do that real hardcore. What kind of money are we talking?
Well, I'm gonna give you, you know, our situation right now. So, you know, we launched Bridge the Gap mental health program here in the city of Omaha. Let's see, back this late summer. Okay, we launched that with private donations. I don't belong to a church, so I tithe to my community. So my tithing and offerings went to my organization to kind of jumpstart this. We made negotiations with POC therapists in the city, where we negotiated rates for individual and group therapy that they agreed to, which is way less than what, they're worth, or way less than what Medicaid is paying. So I thank God for them. And then we partnered with Capstone Behavioral Health, which their interns, they don't charge a fee. So that was a way for us to keep costs down. So we presented this concept and this program to many foundations, to receive grants, and we were shot down because we hadn't been around as long as some of the other ones. And then you have board members that are of older white men who don't understand the cultural aspect and the need within our community. And they look at, oh, well, I know that this organization has been around for years, so we're going to vote to give the money to them. And that's a problem that we constantly, run into. Your organization has been around for years and you know them very well, but what have they really done? Because our people are in the same position as they've been in decade after decade, year after year. Okay. So to address this issue, we did thankfully pitch this to our county commissioner, Chris Rogers. Chris Rogers, along with Charles Drew, the Charles Drew CEO and the director of the mental and behavioral health, Mr. Larry Duncan, who was very familiar with my work and our services, and vouched for us. And so we were able to get some of the ARPA funding, but unfortunately, the funding only supports the program and not my position to run it. So I work for free, just about
Wow.
for free.
I
And
know.
so, but the program is funded. So we have plenty of funding to take care of our therapists and to pay for the individual and group therapy, to cover, we have the funds to cover like the marketing and the administrative fees behind it. But as far as like for case management, which is what I do every day, and the follow-ups, and like I said, our program is just short term. We do a warm handoff to Charles Drew One World Center for Holistic Development, and the private therapists that we work with, we do that warm handoff for more long-term care, and then we follow up, and we also provide wraparound services. That
Okay.
is a full-time job.
I want to, if I can interrupt here, because I want to be careful that we don't spend too
Okay.
much on per se
Okay.
on one thing. But one of the things that hit me, and I know Donna, you and I had a question. I think anyone can answer this. I think we this is one of those kind of questions that have been talked about in the years of mental health assessment. In other words, we talked a little bit about this, like, how do you know what we need? And I know the Douglas County had that declarative statement they had, but how do you know how much mental health we knew? Because I know one of the challenges I learned years ago is that sometimes people keep going to therapists, and they never get well. Or you got people who are spending thousands and thousands of dollars or millions, and the situation doesn't get better. So my question is, has there been some kind of assessment to know what we really need, particularly when you got these silos? And Donna, you and I talked about this at one point. You got these silos and they haven't had no empirical assessment of what the needs are. So how do we set up an assessment that can measure what our really needs is? Because each organization is going to say, we need this much money. You just said that we need this, that. How do you know what you need as a community to make sure our community can be healthy and whole?
Talk to the
Well,
people.
it would seem to me, yes, Tamika, that's true. But in the mid 80s, when I first started in this work, I went to Minneapolis because they really have a lot of experience working with diverse groups around all kinds of issues. And they had assessment centers. A person who was in need of services could walk into an assessment center, get a computerized assessment, and what didn't need to be a licensed professional, because you're talking about a computer. And they would walk out with what level of services they needed, and then it was up to them where to go to find those services. Here we rely on, like I said, a broken system where you access the services that probably at the same place is going to say they have what you need, or I'll send you over to this person that I know.
Right.
And that's how we often end up in places where year after year after year, we keep going because we never have reached our goal. We reached their goal, but we don't even know. A basic question to ask is, what happened to you?
Right.
You know,
Follow.
we want to say, how much do you drink? How much do you smoke? How much meth do you take? But we never get around to what happened, you know? And so that's what I'm pushing for, is a change in the system. Now, of course, as Tamika indicated, she doesn't have the money. Well, how much money is coming into Region 6 and where is it going?
Right,
Somebody needs to be accountable for assessing the programs that exist, and there are over 600 nonprofits in the zip codes that used to be North Omaha. And I don't
wow,
know how many of them deal with what we're talking about tonight, but we need to do an assessment, see how well these programs are doing, shore them up. We don't need to get rid of them necessarily, but what is it that they need? Like Tamika's organization, which I'm not familiar with, but I've learned about it tonight. And see, and there are other
right,
people that
gotcha,
are struggling, trying to help their community.
gotcha. All right, Nick, you gonna talk now, Larry?
Yeah, yeah. So our fourth panelist is now on, Larry Duncan, and Larry was mentioned in passing by Tamika. So Larry, I'll ask you a question. You know, with your role at Charles Drew, you know, from your perspective, you know, how do you assess sort of some of the needs when it comes to mental health that you're seeing in the community? And, you know, also to make it a little more specific too, what are some things that we can propose to some of our elected officials, whether it's people in the state senate or at the county level or city level, to try to improve some of the things that has been discussed tonight?
Okay, thank you. I appreciate the invitation. Sorry for the late arrival. Had some priority things to take care of, but it's good to be here. So to your first question, I would say just from my experience and looking at some of the national statistics, the need in regards to mental health is not much different than really any other community. There are going to be a number of people who have issues with trauma and seeing things, hearing things, paranoia, etc. The type of issues that require medication, and that's not terribly difficult to assess. Somebody comes in and says they're seeing something that's clearly not there, then we obviously know that there's something wrong with that individual, something's wrong with the way their brain is functioning, and they may need to see a psychiatrist or some other individual that's going to prescribe something to rectify whatever that problem is. So we're going to have some people that have real live medical, something is wrong with the organ called the brain and the way that it's functioning, and they're going to need some medication to deal with that. Then we're going to have people with a variety of different cognitive issues, basically the way that they think. And then as Dr. Donna said, having to do with the type of things that they've experienced in their lives, whether it be some form of abuse or any other kind of human being malady that has taken place. We're going to have people that are struggling with dealing with their past, dealing with events, dealing with things that happened to them, dealing with the way that that has affected them emotionally, mentally, psychologically, and then they're going to need intervention. So then that's kind of the playing field. There are these cognitive issues, and then there's these physical issues, and then there's these terms that we use like trauma and those type of terms. They're present in our community. They're present in every community. The thing that is unique to us, that is an extra layer that perhaps other communities do not have to deal with, is the institutionalized racism, the oppression, the marginalization, the lack of services, the poverty, the enforced poverty, the on and on and on, are not all cultures have to deal with that. That's something that's unique to our culture, that gets, from my perspective, that doesn't get recognized, appreciated, et cetera, to the degree that it needs to. So to some extent, that was the case with the Declaration. that I think was mentioned earlier. Somebody mentioned the county's declaration of mental health as a major issue, et cetera. So in that respect, but in regards to recognizing these issues and how it affects a culture, how it affects a people, how it affects how people think, how it affects the potential for problems and suicide and violence and people basically not liking themselves and not liking people that look like them and all those kinds of things. That's for us as clinicians to understand and deal with. And one of the things that we can do.
We'll move, but let's just finish the move. We're going to open it up. We got two more questions on it. If you let me finish up, because we're going to be conscious of all the feedback coming in. But finish up a little bit and move to the next question.
Okay, I'll just say this, that our clinicians can be essential in training the rest of the population and other clinicians in bringing these issues to the forefront as far as policy, et cetera, so that that extra layer of issues that other communities don't have to deal with, that we have to deal with, is accounted for also.
Gotcha. Now, you know what, I know it's my turn. We're getting closer. We were halfway through. We're going to open up to the audience. But Frank, I feel we ain't showing you enough love. And I want a question for you. And again, Nick may have another question before we get into the audience or the participants going directly at y'all. If we have a light bulb moment, again, for transforming mental health from your perspective, what would it be? And one of the words I love to use is epiphany. In other words, if you had that magic wand, what can we do to help improve mental health from your perspective? And I'm going right at you, Frank, on this one.
Having more clinicians that could practice being trauma therapists. There's a limited number.
Hold on. When you say trauma, what does that mean? Because you lost me there, because I'm still
practicing, able to practice EMDR, able to use innovative things that can help develop emotional resiliency.
Gotcha.
You know, I'm like one of a kind. I've got to teach other people what to do, because in our community, intergenerational trauma, childhood trauma, institutional trauma runs rampant. And when the person doesn't have the emotional resiliency to live their life, then all these other mental illnesses become so overwhelming. You know, to me, if I was able to do something, that's what I would do.
Gotcha. Nick, did you have something else? Because we got about a few more minutes before we open it up. Nick, do you want to say something else?
Yeah, I have a question for Tamika. You know, kind of a two-part question. The first is, what are some things that, you know, collectively we might be able to propose to local officials to, you know, direct funding where it would be helpful? And second, to the average person who doesn't have any kind of specialty in mental health, where can those people help? You know, are there places that, you know, that they can donate, or places where they can just support in maybe a non-financial way where it would be kind of helpful to the things we've talked about tonight?
Yeah, so with our organization, you know, we do have volunteer opportunities. Like I said, not only do we offer the Bridge the Gap mental health program, but we offer wraparound services such as, you know, violence prevention, intervention, crisis intervention, victims assistance, things like that. And so we address, you know, those things that cause the trauma, you know, that introduce that trauma to the individual. And so we do have, you know, advocates that can help, you know, in that role. You don't have to be professionally trained to be a human being, you know, and to offer that empathy and, you know, that support, you know, to the individuals or the family that has experienced, you know, that trauma is currently in that circumstance. And as far as funding, you know, we are a nonprofit organization, and when it comes to funding smaller and newer nonprofits is difficult. You don't just automatically get funding because you're a 501c3. You know, it's really, you kind of gotta, and it's been my experience, I gotta debo my way in and keep coming after you say no. I'm still knocking at your door. You told me no last month, and here I come this month knocking, you know, and letting you know, what I'm doing is working, and this is my case evidence. You know, we don't have, you know, a bunch of fancy you know, what do you call it? Like evaluations or anything, but we do ask the question, we do ask the people, how can we help you? And the people know what they need. They may not know how to get it, but they know what they need. They know what they're lacking. And sometimes all you have to do is shut up and listen.
There we
You know,
go.
I don't mean to be so blunt, but that's the bottom line.
Yeah.
You know, just listen to the people, give them that respect and that attention to be quiet and listen to their needs, and guarantee they'll tell you. Now, they may only tell you just a little bit because they're trying to fill you out, because that trust is not there, you
Right.
know, in the community, and you have to build that trust. But with our organization, we're at the front lines, you know, doing this work, and we're building that trust. We have community programs, community events where we're building that trust. We're offering those resources at any community event that we have. We share the platform with other organizations and collaborate with them. And it's basically to let the community know we are there for you. This is not a handout, you know. These resources are there if you need them.
Gotcha.
Okay, and we're here when you need us, and we show up not just for the bad moments and the crisis moments, you know, when something happens. We show up even in good moments, and to celebrate us as a people. And even in the middle of that celebration, you may need something.
Gotcha.
So I think that we have to address it from that aspect, and address the situation culturally and holistically. And like I said, and that's thinking outside of the box, outside of our norm than what we have been doing things. So I think that's
Good.
what we need to do.
We're right at a half point waypoint.
But-
Did you have a follow up to that, Nick, or anything?
I just wanted to say something, Ajamal, before you go to the
Audience.
audience for questions. So whenever that's possible.
I'm just going to ask one more question to Larry, since he joined a little bit after we started, before we open up, and then Donna, I'll go to you after that. Larry, just for people who might be watching this after the fact, who are looking to get help, and maybe they have, you know, a child who maybe isn't ready to see a therapist or doesn't feel comfortable. What are some resources that a parent could give a child that could help when it comes to mental health, if that person's maybe not ready yet to see a therapist, or maybe they don't have the financial resources to see a therapist? So I guess, you know, from child to adult, you know, what kind of resources are out there that you would recommend that people might not know about?
You know, I think a very distinct and definite and solid and need to say no more resources is right here in the presence of Ms. Mease, who has created a program just specifically for that purpose, where it is a gap, a bridge, where you have kids who may not want to be ready to see a therapist, but they can still have some interaction with people who are tuned into their issues, and when they are ready to see a therapist then. So I think that program in particular, and programs like that is a primary resource. You have others in the community like U-Turn and other programs like that. In addition to that, I think we underestimate the value of churches. So you have people who are upstanding people in the community who can lend themselves toward being mentors, as well as other mentoring programs that are in the community, the various clubs where people can have in contact with solid people. So the theory is that every kid needs at least 4 solid pro-social people in their lives, whether it's a parent, a coach, a teacher, a mentor, a whoever. At least 4 pro-social people in their lives, and that being the case, that would be an easy referral. Once that person is ready, it'll be very easy to refer them somewhere where they can get help. And the last thing is, there are, you know, for instance, our program, as well as other programs, at this point, especially with Medicaid expansion and all of that, money really should not be a big issue. So if people are not getting therapy, it's not because there's some money barrier. There's plenty opportunities with school-based health systems and various other programs like what was mentioned, Region 6, et cetera, where there is access to services at a sliding scale fee or absolutely to some extent free if people cannot afford it. So I don't think finances at this point is a barrier to services. It may be same thing with stigma, ignorance, and those kinds of things may be barriers. But I would say money to pay for it and insurance is not as much of a player in the problem barrier situation as it was.
Larry, there are a lot of people who would disagree with that. And I respect your opinion, but sometimes it's information, knowing where to go. In other words, who gets in, and it's like having insurance. Some people are scared that if they don't have money, they won't get in. So part of what I would argue is there should be some better outreach if what you're saying is true and you believe that, whether it be Charles or elsewhere. But we got to do a better job of communicating what's available, because again, there are people on waiting lists. And again, that's part of this discussion today is how do we disagree or how do we raise the point? So if there is a gap, how do we feel it, particularly as a community we serve? Donna was going to, no, why don't you come back? You want to maybe say something? Go back to Donna then, I guess. You want to say something else, Larry?
Well, yes.
I'll just say there's a difference between being on a waiting list and not and having to pay.
Okay, got you.
I'm not saying that there's no waiting list. I'm not saying that people can always get into service today. I'm simply saying that the funding part, the money part,
got you,
is not as much of an issue as it was.
Got you. Appreciate it. Thank you. Donna, I think you're going to come in.
Well, I just have made a commitment to myself that I will never be on have the opportunity to say something and not say it. And again, I've been, just traumatized by the fact that our kids are killing each other and others. And I hear a lot of talk, and I'm not everywhere and I don't know what's going on, but I want to offer to anyone who has a solution or even wants to try something to intervene. We don't make guns. We don't sell guns. We don't make bullets. We don't sell bullets. So for those people who don't agree with me that the new rope is the gun, and some of the older people on this panel should understand what I'm talking about.
Right, good point.
But if we don't do something, if we don't care enough to do something, then it's not going to happen. Right. And our children are crying out to us, and we are doing a lot of talking, but where is the action? How can we save our kids? And it's bad here, and it's just as bad in our Native communities.
Gotcha.
And so I'm trying to get people organized around that issue so we can talk to those sovereign nations to see what we can do to save our kids.
Gotcha.
Because we're talking, and money is playing a major role. Before Medicaid expansion, it wasn't easier to get in, but now people want to know how you're going to pay for this. Right. And they can say they don't say it, but they do say it.
Wow. You know what? We're right up on that time. We're past it. And you know what I would like to do, if it's okay, again, call Audible Nick. If we can let people ask their question directly. Maggie, I see you're in the house and you had a good point there. So can you speak it out and say that and then follow up again with whoever else wants to talk? Karen, if you could speak to the people directly. So Maggie, go with your question first with your comment.
Sure. I've had it done and it's like a magic wand. It's amazing. But Mr. Bailey, if you could comment or explain a little bit more about EMDR, because you used that acronym a couple of times.
EMDR was basically invented or developed by Francine Shapiro back in the probably late 80s, early 90s. And the thing is, the whole theory behind it is that the rhythmic movement of either a light or tapping or buzzes help process past emotions and trauma. Because the thing is with trauma, the past emotional states enters the present and the person is not able to function effectively. And what EMDR does, and I've been using it for the last 8 years, it allows the person to process the trauma, to be more present, to live their life.
Gotcha. I saw a couple other people there. Karen, you threw something out. You must have looked, got it so nice. You want to say something, Karen, yourself or anyone else on this?
I just looked that up to answer the question, but I did want to get back to some of those issues around gun violence. And one of the things that I feel that we don't pay enough attention to is the interconnection and the weaving of so many of the risk factors and protective factors. I think it was Larry, that you were talking about some of the protective factors. I mean, when you're talking about preventing mental health problems, when you're talking about preventing gun violence, when you're talking about preventing teen pregnancy, when you're talking all those prevention, substance abuse, they're all intertwined, all of those factors. And I don't think we do enough as a community to really work together to think through how do we support individuals and how do we support communities to increase those protective factors and decrease those risk factors. That's my 2 cents.
Yeah, if I could add to that, just specifically when you talk about violence and you talk about the gun violence and all, specifically talking about that. One of the things that we do well as clinicians and people who've been in this field for as long as we have, what do? We're able to look at what is best practice. In other words, what has worked the best. When I'm the city that I'm from, my hometown in Chicago, that's
Wow.
cited as the violence capital of the world. And when you really get the numbers, Chicago is not. It's actually one part of Chicago that where the numbers are what they are, but Chicago as a whole is not high. But nevertheless, that's a place where the work was done. They formed a group, they funded a group. And so to that point, to Tamika's point and to Dr. Donna's point, funding for groups that are not necessarily clinical or 501(c)s and all those kinds of things, that is a problem. So when I say funding is not a problem, I'm talking about for individuals accessing therapy. But funding for innovative programs to address these issues is a problem. So anyway, there was a program developed called the Interrupters. If you go back and do the research on it and look it up, you will find that when Chicago was at its peak in terms of gun violence, these individuals implemented a program on their own, grassroots program, basically where they identified that when these things happen, there is an offense by somebody, and then that offense warrants a response, and somebody's got to interrupt. Somebody's got to get in between this offense that based on the street says, I've got to do something to you because you offended me in this way, you disrespected me, blah, 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 whatever type of thing. Somebody's got to get in the way of that. The grassroots people identify, the numbers came down. Go back and look at it. The numbers came down drastically over the course of time with the implementation of this particular program. Then what was happening, it was so good that it did get funded. It got funded, right? And it became crystallized, it became formal. That grassroots program was doing it on its own without no funding, became funded, and it was continuing to do better. But at some point in time, the funders decided, well, we're going to take the funding away. Funding went away. At that point, the program went away, and guess what happened? The numbers went back up. So in regards to specifically what's necessary to address violence, I suggest we research not only Chicago and the Interrupters program, because there's other programs that have already done it, already did the work. The stats are already there. We love stats. The stats and the information is already there. And then do what's already been done. And a lot of times that's going to mean involving people who are not necessarily clinicians and master's level people and doctors and all those kinds of things. Sometimes it's going to involve sanctioning and involving some grassroots people who've been there and done that and know what they're doing, can actually go to the street and interrupt and get involved in the situations that are really happening in a real live, real time situation.
Folks, this is open now, so anyone got a question, comment, we're gonna let you speak directly to our distinguished panel members, or if you want to raise a disagreement. This we about community conversations and more. So anyone else, any other feedback? I got about 20 questions, but I'm the moderator, co-moderator, so I need to hold back and let y'all talk. I had my chance.
Well, I just want to say, since our health department declared racism as an issue, I don't understand why they haven't declared teen violence or gun violence as an issue, period. I mean, the whole DEI thing, that sounds good. We don't need it where I work because we're very diverse, because I'm in charge. And so I don't know one DEI person that has the authority to hire anybody. You see what I'm saying? So
Right.
why can't they look at violence and what it's doing to our communities? Because I don't live in North Omaha, but I'm traumatized by what's going on over there. But people don't even understand that concept. So that's why I'm saying, and the other thing is, Brother Duncan, you know, we all have disposable income. You know, Tamika, who says she doesn't even have a salary, she tithes and gives to the community. I would do the same thing if I thought it was going to result in somebody taking some aggressive action to stem the violence, these kids killing each other and other people.
You know, Donna, I appreciate you sharing that. I had a neighbor who said to me one day, and I didn't know how to respond. He says, one of the concerns he has is the violence that we have in our community, particularly amongst people of color and African Americans. And he says, what can we do about it? Is that something that we should focus on? Because every week we turn on the TV or the media, we hear this violence. And again, it's a mental health issue, obviously. But my point is, his question was directed and says, where are we at the table to reduce those numbers? Again, you throw money at the problem, but I don't know if they addressed, Donna, what you just got through saying. And then I think years back, Donna, you made a point where sometimes when our kids are traumatized, we don't run the interveners in to help them out. We run it when something happened out of school in West Omaha, but some of these kids see some of this stuff every day and then they follow through and you see this whole revenge thing. And Larry, I'm gonna come back to you something a little bit. It's kind of a different question, but even though you have this program in intervener, have we not had that in Omaha? I've heard people talk about it, but we never had anything like that to deal with the violence for us in this community. There's no institution that does that. Donna, you said no?
No, I'm not saying no. I believe that there was a program, and I can't remember
Turn
exactly.
Omaha.
Say it again.
No, that's the current one. That wasn't the original
No,
one.
we had Mad Dads.
There was Mad
Dads were
Dads.
the ones in their green blazers. They walked the streets.
Yeah.
And tried
Yeah.
to address violence.
Yeah, and they had some success.
Yeah.
And they were recognized nationally based on the success. And there was somebody that came after them, number eight. Somebody here may know the name of that program that came after them. That was ultimately disbanded and formed a number of other groups. But yes, I think there has been some programs in the past, but my point was there are some things that have been identified as effective. That's all I'm saying. So I mean, we don't have to sit here and wring our hands and like we don't, there's no answer. Let's just, wring our hands about it. There's some information that says there are some things that are effective, then we can employ those things to the best of our ability here. And that would be a wise way to go about specifically the violence.
Gotcha. Other feedback, other reactions.
I'm still curious about the work that Frank Bailey is doing. As Nick was speaking at the event in North High, he was telling us about it, but I still want to hear more from Frank about what services he's offering, because like Dr. Donna, I'm really concerned about the violence in North Omaha. Just like she said, with racism being a mental health disorder, this Black on Black violence, like they say when they were saying Black Lives Matter, I heard Dr. Donna say one time, it matters when police are shooting Black people, but what about these teenagers killing each other? And then it's like, once they kill each other and they harm each other, again, we don't know what happened to these kids. What's making them think it's okay to just ride by somebody's house and shoot through the windows, not caring who these bullets strike. That seems like that's a form of mental illness as well. So it's like we see it's happening, and then we hear, that people are offering services. But again, it's like, how can we be something like interrupters that Larry Duncan was talking about? Because this stuff is happening. And then like, I know people in the penitentiary and they're telling me that the mass majority of individuals locked up are suffering from mental illness. So it's like throwing these people away for a long time is not working. How can all of us come together and actually take action to work together to save some of these youth. We understand that mass incarceration has incarcerated a lot of the parents. A lot of these parents, again, like someone was making reference to being on 30th and Ames. When I'm down on 30th and Ames, I look and I see so many women on drugs. I see so many men on drugs. It seems like there's an influx of drugs in our communities. I mean, it seemed like now we've gone past marijuana and crack, meth is here, fentanyl is here. All these drugs are here and it's messing up everybody's minds and everything is just out of control. It's like none of us are safe. So, I mean, we as a community, we have to do something collectively together. That's why I thought it was brilliant to bring these brilliant minds together. Dr. Donna Polk, Bailey, Duncan, Tamika, Mease. I mean, we all have to start coordinating and working together. We have to address this problem because it just hurts my heart to see these kids dying. And it hurts my heart just as much to see these kids getting these lengthy penitentiary systems, knowing that hurt people. So I'm like, what action can we take? What can be done? Frank, could you please speak more about the service that you're offering overall? Because I know you do a lot.
Well, the thing is, what I've just developed, the program I wrote and put together, me and Mr. Wells and Bailey trauma intervention specialist. And so the whole thing is I'm taking everything that I've used over the last 8 years and have developed this program based on polyvagal theory, which is sound intervention to heal the nervous system, which is based on interpersonal neurobiology. When you're talking about like mindfulness, meditation, you're talking about EMDR, and you're talking about peer support. And the whole idea that we have, the whole idea that I developed and put together is that being able to work with complex trauma when it comes from what the adolescent young man is dealing with and the family also. You got to realize when somebody goes into the system, they're not working with the whole unit. They're just working with the adolescent. But guess what? The parent has the trauma also. So they've got to learn how to be different and how to be more emotionally resilient, and I've worked with that. And I understand what Tamika's saying. I met with one leader. He told me because we ain't been around long enough, nobody's going to give us any money. Well, the thing is, I'm trying to save lives. It's something that there's not anybody doing that within 500 miles within Omaha. That's the whole thing. So when you're talking about innovative and what I'm doing, we can't even get referrals for that program. When I talk to maybe somebody in probation or HHS, they're not sending me no referrals. It's coming by just word of mouth, So we're talking about something that's innovative, that's going to work. If I've been using this for the last 8 years with people coming out of prison that have been in isolation for 2 years and their emotional resiliency begins to change, that they can live a life, how effective will it be with kids who are coming out of COVID? And when you look at what's going on, it's because of the lockdown and all this stuff they went through. So you have just violence is going out of control. So that's what I've worked on. That's what we developed. And the thing is, we want to save lives, not watch people die. And if we come together, we can save lives. But if we don't, the same thing's going to continue.
Good, thank you. Appreciate that. Other questions, other feedback? I got one I'll throw out because I think it's part of the conversation here. Tamika, when you were talking, and I hear Larry and other people talk about what you do, and one of the things I learned working at Douglas County, looking at data, was oftentimes we talk about what we do, but we don't produce outcomes or data on tangible success rates. In other words, even if you say my client has satisfaction. So my question in general, I guess to everyone who's on the panel is, how do you measure success from an empirical point of view in your own respective program? Again, some people talk about how much money they get, how many hours they spend, but I don't know. I'm just asking the question, how do you, if somebody walked in the door from another planet or from the future, they say, hey, how do you measure success? How do you define it from your perspective in the programs and things that you do, respectively?
I would say that, first of all, that's kind of baked in the cake now. So in other words, really, it's, you're not, if you are certified by any national body to do whatever, like in our case, a health center, you have to have data that says, is what you're doing working? So most organizations have all kind of elaborate programs and tracking systems to say we're effective. Now, you know, how true that really is and what you can really do with numbers and all that kind of stuff. That's a whole nother conversation for, you know.
So Larry, if I'm
another
gonna
day.
come directly at you, how would you, Charles Drew, if you say the work that you do with mental health or whatever you do, how would you measure it, or what criteria do you use in your own modality or let's say your environment? How do you do it as your organization to a lay person who don't understand this question?
So that just give you something real quick. So every time we have an encounter with an individual that's surrounding anything having to do with mental health, there is a form that is a nationally recognized form. It's what's called PHQ-9 that's given. We have one for adults, we have one for kids. They fill it out. It says what their symptoms are. It says whether or not they feel they are making progress. It says whether or not they feel like they're not making progress. And then you put that in, you feed that into your EHR, your system, and then at the end of the year, it spits out the numbers. It tells you how many people said they were doing better. We do surveys of all these people, et cetera. So how you slant that, what that really means, you can debate that. I could say it's great at my organization and we do great. Somebody else can come along and say, oh, that's not true. You don't do great. We can do that all day. But the point I'm making to you is most organizations and certifying bodies require that now. Region 6 requires that. If you're getting Region 6 funding, you have to put in data on a quarterly basis as to what you're doing in regards to that. So, but my last point is there is not one modality that's more effective than any other. And what I mean by that is what Frank is doing is important, prevention is important, education is important, cognitive stuff is important, violence intervention is important. All these different continuums of services is important. And when we get into this particular service and this particular population and this particular problem is the problem that must be dealt with, can't nothing else, then it's dysfunctional. All of these things matter. Prevention matters, pro-social, and all that stuff matters in terms of how we set up a continuum of services in a community to have an impact on preventing and reducing these numbers.
Good, thank you, appreciate it.
If I can say something, I think what I'm most proud of is that I have former clients going back to 85 when I first got out of school and was able to practice solo, well, not solo, but not under clinical supervision at UNL, who are sober today. And I have employees that we've hired who went through treatment. One has 25 years of sobriety. So I think the proof is in the pudding. I've been doing EMDR for a number of years. It's, you know, what Larry said is true. One size doesn't fit all. And certainly few people have experienced trauma at the level of Native Americans contemporarily, not historically. But they might find 80 bodies in Genoa at the boarding school. They may find bodies at any boarding school where Native kids were taken from their families in an attempt to civilize them. It's despicable to even think about what those kids went through and the fact that they were buried and their parents or relatives didn't even know where they are. You think that's not traumatic? When under the director of the Interior, a Native woman has mandated that this will happen. So I'm saying that, you know, the proof is often in the pudding. It's just like people can go to a medical doctor and not receive the care that fit them. They can go somewhere else and get the care. But we have to have a workable system. And that's what I believe we do not have at this point. Individually, we all do good work, but put it together and the system is not functioning. And I'm sorry I have to talk so loud and wave my hands, but I get emotional on this. It's so
all good.
It's
There is a question in the chat related to something Dr. Donna brought up, which was about EMDR. This person is asking if there are any local programs that offer training for EMDR or other trauma-based interventions. So that might be for, you know, we talked a lot about cultural competency and therapists who you know, don't have experience in how to properly interact with the community. Is there training for sort of new graduate therapists or people who are just getting into the field to get sort of some of the certification?
Yes, there is training available, and you can go, I believe, on the website and see where it's being offered. I've noticed that there seems to be an uptick in the availability of training, but sometimes it's not local. I was fortunate enough to be able to receive training here in Omaha, but you may have to travel to get the training that meets your needs and maybe not your schedule, for local training. But it is very innovative. And Shapiro developed it in response to the needs of the military. And you can only imagine how traumatic it would be to serve in an institution where you're often killing people that don't wear uniforms. I tell people, and I'm not a historian by any means, Vietnam was the first war that we fought where we just randomly kill people instead of identifying those people that had to be killed by uniform. And it's almost like it is now. It used to be in the neighborhoods, and I did go to Compton and Southeast LA to look at gangs, and it was very discernible what to wear and how it associated you with the gang. But now they use a lot of different symbols and colors and athletic teams, and you don't know who is who and what neighborhood to avoid. And that's what I'm saying makes things so traumatic. It's affecting all of us. The law enforcement loves to cite, well, we have 10 fewer people being killed this year than we did last year. I don't care if it's one person.
That's true.
One person. Just think of that young 15-year-old woman sleeping in her bed, and she's killed. Come on. We had a baby girl killed who was eating cereal at her table in her kitchen. Sorry, again.
No, you don't have to be sorry. A lot of people have righteous indignation because of the arrogance of how we don't address the issues or we gloat
You know
over.
what, Azuma, I keep a book that I have on my coffee table that's pictures of lynchings, just lynchings, okay? Just lynchings. And how I know my ancestors didn't tell who did it, and these people don't even have a Klan mask on. They're standing there with their kids. And I'm saying we know who the killers are.
Right.
And we don't tell. And one Black man that I talked to, like I'm talking to you, he said, because I'm afraid they'll kill me. And I said, thank you, brother. Thank you. I appreciate you being open and honest about it.
Well, Donna, that's part of the conversation also. I do know that some of the people have shared with me over the years that they sometimes want to tell because they feel some of the police officers tell on them or they use leverage. In other words, here you want to report a crime and they find out that they found out you told from the very law enforcement people who don't care. They don't live in the community. So they lack credibility. And you're right, going back to the data, they run that out as if we're better than this city or that city. And you're right, any child or any person that died a death like this is something we should be concerned with. They're not playing with the numbers. We got about 14 minutes left or so right now. I want to give other people who haven't had a chance to say anything, raise a question directly to the panel member or make a comment.
If I could just take a moment. This had been just a really kind of gripping kind of thing for me. So first of all, I just want to say that for the panelists, Frank Bailey and Dr. Donna and Larry Duncan, I myself have actually benefited personally and specifically from all three of those conduits and outlets. So I'm going to be as brief as I can to compartmentalize my thoughts and my comments here. But I definitely wanted to individuate and give a shout out to the panel. So Frank Bailey, I came to know Frank over 15 years ago when I was a client of Dorothy B., which was a transitional living house. Basically, I was under the auspices of some criminal charges related to some substance abuse, et cetera, et cetera. Frank worked there. He didn't own it. He didn't run it. He worked there. So that was my first initial encounter with Frank Bailey. That was over 15 years ago. So I remember him from then. So benefited from his services, his tutelage, his wisdom then. That was in the year 2005, 2006. Dr. Donna with the Nebraska Urban Indian Health Coalition. For myself, non-enrolled, but a declared member of Comanche Nation of Lawton, Oklahoma, and my wife being of the Omaha tribe, have benefited from various intertribal services that have been provided from Nebraska Urban Indian Health Coalition. And then, of course, just being a lifelong resident of Omaha, Nebraska, 35 of my 39 years in North Omaha. Obviously, I've been to Charles Drew. So in some way, shape, or form, Larry Duncan as the director in that explicit role has affected me as well. So that being said, I wanted to thank the panelists for being here. Ms. Mease, your fire, your passion, you definitely need to continue that, and just always keep in mind that on paper and when it comes to funding, data is important. So definitely you want to make sure that you have numbers and that you're doing numbers and you can back that up. That's going to be a very important piece. But I heard a lot of things that resonated with me personally and specifically. All that being said, again, I heard a lot. I saw a lot from a lot of different people. I can touch on the Native American issues. I can touch on the mental health issues. I can touch on the gang issues. I can touch on the employment issues, wherever you want me to start. But overall, what I wanted to say and what I observed and everything throughout this panel that I'm very grateful for is just the opportunity to just hear from different people that's in the community doing different things. Is very difficult to unify and organize because of the systemic racist systems that's in place, the old guard, if you will, as far as funding, exposure, et cetera, et cetera. So all those things are very important to note, and everybody alluded to that and made comment of that. So that's very important. So I'm kind of getting jumbled and everything like that. There was, again, it's just a whole lot going on. Very, very enriching experience that I had. So I want to thank Ajamal and Nick as well, my fellow board members for putting this on. Is just something that it's just emotionally is very gripping to me. But one thing that I want to say, if I could just take maybe just another thought that I could express here about something that I observed and just everything is when it comes to mental health with people of color, something that we have to understand is there's definitely the stigma. It's looked upon as weak, not only as the person is crazy is, well, you can't handle it. So you have to go talk to someone. And then when it's not a person of color, then there's an additional layer and depth of difficulty, if you will, with assessing and developing and taking advantage and engaging those services of, well, you have to go to the white person if it gets to go that far. But ultimately and primarily it's, oh, you're too weak to handle it. Because the stigmatism in the communities of color, whether we're talking about the African-American community or the Native American community, both of which I call myself a proud member of, there's still that stigmatism where we still have to handle everything ourselves. We have to internalize and compartmentalize. And Jamal, I mentioned this at our last in-person meeting, Waishal as well, real quickly, and then I'll sign off and I'll step away with that, is the topic or the phenomenon, if you will, of adultification when we're talking about mental health in communities of color. And if you're unfamiliar with it, primarily and ultimately adultification is children, juveniles of color are classified and considered in a much more mature, demonstrative light than their counterparts of other ethnic groups of color. So for instance, 3 black males will be considered and classified by Omaha police as a gang, whereas 3 white males of a juvenile age may or may not be, likely not be considered as a gang. It's just three kids walking down the street. And also, and in finality, when you see people of color as either suspects or victims in violent crimes, it is often and frequently they are communicated and described as men. A 16-year-old man robbed the bank or was the victim of a drive-by. An 18-year-old man was arrested for a drive. But when it's not a person of color, they're referred to as a boy, a teen, a juvenile. To the young man who in Douglas County beat up his grandmother with a baseball bat, fired on Douglas County Sheriff, taken alive at the age of 18. The case went to trial at the age of 19, and it was still reduced to juvenile court. And then the final exclamation point for my statement, Nico Jenkins, who we all know and are familiar with, was convicted as a juvenile and sentenced to adult prison time as a young man of color. So if we kind of flip-flop and kind of what if those types of situations, obviously that's an extreme, but I do that to kind of get you to think about the exacerbation of what's actually happening here. So my name is Alex. Thank you for your time. Thanks for letting me share. And I appreciate Ajamal and panel and Nick as well. So thanks so much. I appreciate it.
Thank you. We're bound to probably our last 7 minutes or so right now. But before we get into the wrap up or winding down, there was something that just hit me as we were talking. We have the state of Nebraska Department of Behavioral Health who have no systematic contact with some of the people in our community. And I know I've interacted with them and they really don't have much of an outreach. I know they got a number of openings. And we also have about $1 billion surplus, not a million, but $1 billion that's sitting out there. You got all these positions and fundings streams. We had a governor who reject money from the federal government. So we got some serious issues in our state government of dealing with behavioral health issues. And I do know when I've sat in some of those meetings, and I'm not trying to be funny, I'm the only African-American in the room and probably the only African-American male in the history of the Children's Nebraska Children's Commission. So some of the very things that you're sharing today, the staff members of these organizations need to hear. It's obvious they have no social capital in our community, so I throw that out. But if you got a Department of Behavioral Health, some of the very things that we talked about with state funding should be addressing some of these issues. I'm just going to stop there. But anybody else, we got about 5-7 more minutes at least before we get down to the evaluations and close out.
I did want to put another question out. This one to Tamika. Is there any other grassroots organizations that you collaborate with that you wanted to give a shout out to, or that you think should also get some attention from those who are watching?
We definitely, thank you. We definitely collaborate with U-Turn, and of course with Charles Drew. And in our position, the name of our organization, North Omaha Community Partnership, is of that nature, to partnership and collaborate with other organizations in the community that's doing the work, because we cannot do all of the work and we can't do it by ourselves. So even though, I have just those few that I have called out, and also Urban League of Nebraska, the organization itself, and also Urban League of Nebraska Young Professionals. We work with them, with the young professionals within the community. Excuse me. And there's a few others, that Project Noise with Robert Wagner. We work with them. And just other individuals, that are not tied to an organization per se. We also work with Black Agenda Alliance. We also work with Untamed, Sherman Wells, who is our Director of Community Outreach. So just those grassroots initiatives that are on the front lines and actually working and interacting with the people, and not just when something happens. We interact with the people and build that trust with the people. And that's how we're able to, break down those barriers and address the stigmas and offer the resources that we have to offer, such as the mental health component. And I think that is very important. And a lot of the larger organizations don't have the capacity to do that. So they should collaborate with smaller organizations and grassroots initiatives like ours to impact those that are off the grid.
Good. We're down to the last 5 minutes. Nick, did you want to say anything quick before we start to do the wrap up? Nick, anything?
No, only if Frank and Donna have any closing thoughts that they want to share related to what I just asked, or just anything on their mind that they want to share before we start to wind down.
I just want to say we have a desperate need for Native therapists and counselors. And I would urge people to really try to get the education that is so important in terms of being able to get licensure. I'm not so concerned about being able to get reimbursed for what you do, but the licensure is really critical. And so if you know of people who are interested, please have them contact me, and I'd like to have a discussion with them about this service.
Good, thank you. Anything else? Well, if that point
excuse me, Dr. Donna, were you and Tamika able to connect? Because I know I was supposed to connect you to.
It's okay. I already did it, and I just know her.
Wait, hold it.
I know her family.
Wait, hold it, y'all. Wait, this is not a family unity conversation. We got to deep cap business. Y'all loving this show and loving this good stuff. It's all we all showed up and loved it. Folks, I really appreciate it.
I just want to say, if anybody wants to organize around the issue of mental health, through unity, there is strength. So maybe if we come together, particularly because the legislature is going to convene in about a month, then maybe we can try to correct some of the issues that we've identified in this discussion.
Excellent.
I'm
excellent.
willing. That's a great
Definitely.
idea.
And we'll work on that as a committee. Washelle, we got you. We heard your name out in front of everybody, so we got you out there. Folks, I want to be conscious of time, but 2 points I want to make is we have we're going to try to do a little bit more proactive on bringing our meetings to the community. On the 14th of December, we're going to have the ombudsman as well as the director of Inspector General for Corrections, as well as Child Welfare, Jennifer Carter. This is the second time that we've had them on our Zoom live more event. This is the second time they've all come together as a trinity to talk about some of the problems of state government. So we hope you join us on the 14th, which is Wednesday, 7 o'clock to 8, to talk to them about some of the issues that have gone on in state government. They'll give an update. So we just want to let you know that. And more will be bringing more events next year. I got to give a shout out to both Washelle and Nick for pulling this together and making this happen, because again, one of the things that you've seen is that we're trying to spread the love around our board members, but also get more community people involved. We hope you fill out that evaluation form, make suggestions for us. We're trying to expand not only our budget, but our depth of working in the community on those issues that other people don't deal with, and particularly when you talk about race, anti-racism, and diversity. And again, I appreciate the disagreements here and there, because one of the things I think we demonstrated tonight is we can disagree and we can have a level of civility as we go forward. But at the end of the day, someone's had to speak truth to power. So I really appreciate the love that's been shown tonight. And of course, the feedback from the audience, as well as our wonderful esteemed panel members. So again, a big thank you to all of you. As we always end our program, at the end is more, we basically say, may the force be with you, and Barocco.